start our session and continuing to admit people. Okay. So here we are. Trying to admit people while I do this. Okay. And first, we wanted to really just stop and take a moment because there is a lot going on in the world right now, and it would be a little tone deaf if we didn't stop today to at least acknowledge what's going on. And I wanted us to just take a minute of silence, and in two parts, because we have two things that I think need to happen here. One is we need to stop and just acknowledge the many traumas and losses that Americans and world citizens are experiencing. We know about the George Floyd wrongful death and all that's been going on, and it's raised historic and anger and frustration about historic and contemporary social, legal, healthcare, and economic injustices. A lot of pain is being converted to destruction. So we have that piece of the intensity of what's going on with all the emotions and the hurt that's related to that. And simultaneously in the backdrop, we have the coronavirus, which has killed over 100,000 Americans and also have this ripple effect on all the families who have had those losses. And then just the multifaceted impact of social distancing on our lives, on our economies, on our work. So for the first 30 seconds of this minute of silence, just please, let's respect and honor all that's going on, and you can have that in your thoughts. And then we need to transition to, as my grandmother said, after my grandfather died, she said, Mikey, life must go on. And we have a job to do today. We scheduled this and we need to carry forward with what our task is today. And so in the second 30 seconds, I'd like for us to shift inside, internally, and to ground us in the work that we're going to do today. Notice your breathing, notice your thoughts, and just be present with yourself. No need to change your breathing, just notice, okay? So let me set the timer for 30 seconds or a minute. All right, and so let's let our moment of silence, our minute of silence in two parts begin now. I'll tell you when the 30-second mark begins. All right, thank you, everybody. So now our program can begin. Hopefully we can all turn our attention to the present, to the job at hand, which is very much one of the tasks of being a professional art therapist, which is we all have our lives going on, and we can have any range of really difficult things happening in our own lives at any one time, or great things. Birth of a child, I've had multiple deaths in my family during my career. So acknowledging what's happening, feeling your feelings and getting centered, and then going to work. So just this task that we did alone is one small example of what we have to do, I think, as professionals in caring for others. I wanted to take a moment to introduce our panel. So we have four people, and I'll be the moderator and a part-time panelist. And so you'll see that we have me. I've been in the field for 20 years. We have Megan Martin, who's been in the field for 2 years. Meredith Fleshman, who's been in the field for 15 years. Tina Montagna-Tate, who's been in for 25 years, and Mindy Jacobson-Levy, who's been with us for 42 years. And we want to give everyone a chance, all of our panelists a chance just to introduce themselves. Okay, and so I will start. And I got my master's in art therapy from Hahnemann University, which is now Drexel, way back in 1995. Art therapy was about 25 years old as a formal profession. And really the arc of my career is I became an art therapist because I wanted to be a superhero and save the world and make the world a better place. And then grad school helped me to learn to temper my idealism and to learn realistic expectations that progress is much slower than that. And then I got to work after grad school and had 3 agency jobs and just really realized that I needed to work with children and teens. That's what I was put on this earth to do. And then I was just about to start my family, and because of our family's needs, working in agency jobs with low pay, being underpaid and overworked was a hard position to be. And so needed to transition to private practice, where I joined a group psychology practice. So for 7 years, 2000 to 2007, I was in a group psychology practice. And in that group psychology practice was handed a couple of social skills groups, some friendship groups, and that was right when the Asperger autism population was really just being identified. And so I developed a social skills program based on an art therapy social skills program. I named The Art of Friendship in 2001. Fast forward to 2007, I left that group to form my own art therapy practice, which is the Child and Family Art Therapy Center. So that was 2007, which has grown to have 10 associates. And in 2013, we spun off my social skills program, which still runs, to a therapeutic day camp called Camp Pegasus. So in the summers, we have a creative arts therapy centered day camp for kids with social skills challenges. And then last year, I made a division of my practice devoted to affordable therapy, so people that couldn't traditionally afford our services, they could finally make our benefit from our services in the form of an internship program. Okay, and this year, upcoming, I am about to release the first book. I don't have a hard release date, but later this summer. It's called The Social Emotional Handbook, and it's for parents and professionals, and it helps them to figure out, to learn an ultra positive home or school-based program that can help kids to be willing to practice social skills and coping skills, and to motivate them. It's a way to keep them engaged when normally they get sort of shut down by constant correction. So look for that. I'll be advertising that later. And so that's me. And presently I'm the president of the Pennsylvania Art Therapy Association. Megan, would you please introduce yourself?
Good morning. Hi, everyone. I'm Megan. I completed my master's program in 2017, so I'm very new to the field. I went to school out in Oregon, but I'm from the East Coast, so I came back here to start my career. Before I was an art therapist, I worked as an art educator, and that kind of influenced me to want to pursue using art in a more clinical way. So that's how I decided to pursue art therapy in my master's. I currently am working in the Philadelphia Department of Prisons. Started that in summer of 2018. I've had 2 positions there. I started out working with the inmates who were segregated in what most people know as solitary confinement. We call it segregation. And I worked in that job for about a year, and then I transitioned into a position where I work with all of our mental health patients. Um, and being new to the career, I'm still kind of finding my passion population, but one thing that I've found that I'm passionate about is integrating mural arts into the group process, which builds on some of my previous experience as an art educator, and kind of changing the way I do that with how I do it as an art therapist now in the prison setting.
All right, thank you. Our next presenter is Meredith. Will you please introduce yourself?
Off of mute. Hello, I'm Meredith Fleshman. I am currently, my job title is a bereavement counselor with LVHN's hospice and bereavement services. So I see, as an art therapist though, is a lot of what got me the position. So they wanted to bring more art therapy to the program. So I've been working there for 5 years, but I started at a private hospital. I got my master's of creative arts therapy from Hofstra University in New York on Long Island. I was living there at the time. And where I was doing my internship was a large private psychiatric hospital that saw different kind of divisions of populations from 5-year-old to geriatric, and they had drug and alcohol rehab there and co-occurring programs and partial programs. So I was hired there for my first position, and it really made me realize that like adult psychiatry was where I wanted to focus my attention for future jobs. So moved back here to Pennsylvania and was hired by Central Montgomery Mental Health Mental Retardation Center, which is what it used to be called. But they really hadn't heard of an art therapist before. And this was in 2006. They were having someone run an art therapy group where they were making like bead bracelets. So everything I did there seemed amazing to them. So I was hired as not technically an art therapist, but in their IOP program. So, but I would run psychodrama groups and creative writing groups and visual art therapy groups. So I really got to get a lot of my skills underneath me there in that community mental health setting. And then I got certified by the Pennsylvania Coalition Against Domestic Violence, and I started working with women who were survivors or of domestic violence currently in situations or just had left. So my career developed as like women's empowerment. I saw that people were, and that goes into my passion, people were really not aware that their old ways of being taught how to think about themselves were kind of oozing out into all aspects of their life. So if we could bring that into awareness and then change some of those ways of thinking as adults, that has really been just an astounding journey to go on with people. So that's me. Thank you.
Wonderful. Thanks for sharing yourself. And everyone here is Tina. Will you please introduce yourself, Tina?
Sure. My name is Tina Montagna-Tate. I've been in the field 25 years, classmate of Mike's. And when I first got out of school, I started working in a partial program that was in residential nursing homes. I did that for a while. And then I worked on a short-term care facility in New Jersey, which is a locked psychiatric unit, and worked in their various units over the years, working with people who were profoundly and acutely mentally ill, and decided I kind of, had seen a lot of that and wanted to work with sort of maybe a healthier, more neurotic population, and went back to school. I got a couple extra classes in counseling, and then went and worked at a school in New Jersey for a couple of years as an emergency certified guidance counselor in a K-5 elementary school. And at the same time began working in a private practice, a group private practice. And after I finished at the school, I simultaneously then started a private practice in that community. So I was working in 2 private practices, got pregnant with my first child, and didn't go back to the group private practice. So I've been working by myself in private practice since that time. And I love to use art and creativity to make really individualized treatment plans for the patients I work with, and to bring art making into all aspects of art therapy supervision and my own self-exploration and my work with patients and clients, both adults and kids. That's me.
Great, thank you. All right. And last but not least, we have Mindy. Will you please introduce yourself?
Sure. Hi, I am Mindy Jacobson-Levy, and I have been in practice for a very long time. And one of the things that I love about our field is that it generates a lot of excitement for me in terms of using the creative process and working with adults mostly. I started my career at Friends Hospital, and interestingly enough, I had initially gotten a job at Pennsylvania Hospital, and it was like a 3 to 11 job, and I was going to do art and whatever else, and it sounded a little bit fishy to me that I maybe wouldn't be doing art therapy, engaged in that process. And then a job interview came up at Friends Hospital, and I took the job interview and told my boss, my then boss, that I was going to start with, that I couldn't take the job because I now was taking the job at Friends Hospital. So it was a wonderful experience. I worked there for 8 years, lots of changes during my time there. And I think some of the difficulties had to do with insurance and transitions with leadership. And during that time, I decided that I was working on an acute unit and on a geropsychiatry unit. And a woman came in who was allegedly multiple personality disorder, which is what they called it then. And I didn't really believe in the diagnosis, never saw it. But she did a series of drawings and left the room. She was on a one-to-one, so I knew no one else contributed. And when she left, after the group, I looked at her artwork and thought, oh my gosh, if there is such a thing as MPD, this is it. And that started my passion. And even as I get goosebumps because I still love what I do. So I started a private practice in 1980. So I had a private practice for 40 years and still doing it. During that time, I got laid off from my job at Friends Hospital after 18 years and ended up working in a long-term structured residence at through University of Pennsylvania. It was called West Haven. I then also, because there is such a strong relationship between eating disorders and trauma, I ended up becoming somewhat of a specialist in that area as well, and do a lot of lecturing internationally and nationally on mostly both those fields, dissociation and trauma, and also eating disorders. So that's my passion. I also love to work with people who are cutters. I like working with the people that no one else likes to work with, I think. And I just love what I do. So I'm still doing it. And now I'm doing it virtually because it's what we need to do during the virus. That's it.
All right, wonderful. Thanks, Mindy. So this is your stellar panel who are going to be answering your questions. And congratulations to those of you who are graduating and entering the field. It's a thrilling time. And there are a lot of things to consider when you're moving in. I mean, we wanted to start with the broadest of all questions. What does it mean to be a professional art therapist? And I thought for this round, any and all of the panelists can chime in. And I have a thought about that, and I just think that, when you become a professional, when you leave the nest of grad school, then you need to own your authority, right? You might only be weeks or months out of grad school, but suddenly you're there and your treatment team is counting on you to give feedback, to give your observations from your modality. So trusting the artwork, trusting your training, trusting your intrinsic personality traits that have led you to become an art therapist, and being able to have a voice. I think that's one part. So owning your professionalism, your identity, and your authority to say, no, this is what I believe this client needs from my clinical perspective. When you get your diploma, that's really just your ticket into the field. And you're trained as a generalist, and then the rest of your career is you fishing around and sort of finding whatever your eventual specialty might be. And you might not know what your passion is today, starting out, and you might, your passion might be just I am an art therapist. I worked my butt off in graduate school to get to this point, and so that's where you are. And then you live in the field, and you work, and you go to trainings. And in preparation for this, I know our panel was sort of pre-discussing this, that, you know, no matter what level of profession, your professional career you're in, go to trainings, go to conferences, and you'll be exposed to all different influences, new theories in psychotherapy that weren't even in your graduate school training. That was actually one example for me. When I was in grad school, there was no diagnosis called Asperger syndrome, and there was no high-functioning autism. When I was in grad school, there was only classical autism, which was considered children with helmets who were nonverbal. And then 5.5 years later, all these hyperverbal kids were coming into my office with this new diagnosis that was now in the DSM. And they really, it was a mutual resonance. And I don't know if I found them or they found me, but and that became, you know, my passion and my expertise. So having patience with your career and letting it unfold sort of very developmentally, I think, is another part of being professional. Any other of our, Mindy is raising her hand. Yes, go ahead.
For me, I think it's that above any other identity is my identity as a professional art psychotherapist. That's what I call myself. I did get licensed in New Jersey and Pennsylvania as an LPC. And right now, because art therapy is not licensed in this state yet, I get paid by insurers, which we'll talk about later, with my LPC. But my passion and my dedication is to art therapy. And I've never been bored. And I told my daughter in her career and in any career that if you get up in the morning and you're getting in your car and you put your briefcase or your lunch or whatever it is in your car and you don't go, oh shit, I gotta go to work, then it's a good thing. So I think that's what it is for me. It's having this identity that above anything else, my dedication, my passion, and what I believe is truest to healing is art psychotherapy. And I agree with you, Mike. It doesn't happen, right away. I fell backwards into my area of specialization because it didn't really exist. I didn't believe that it existed when I first got out of school, and no one ever talked about it when I was in grad school either. DID, which is what we call the old multiple personality disorder. But it's that this is what I truly am, and even though my job may have me do a little bit less, which we'll also talk about later, of the psychodynamic or whatever your persuasion is type of treatment, that you believe that this is the road to healing. And that is my belief, that art is the road to healing. It saves lives and it's the road to healing.
Awesome. Any of our panelists have a, Megan, yes.
I think you all really covered most of the points, but kind of building on what you and Mindy said, is when you're a professional art therapist, you're kind of constantly having to kind of define and explain who you are. And that's one of the things as a new professional that I find to be the most challenging, is constantly like advocating for what we do and explaining it to colleagues and other people who you encounter when you're working in the field.
I think you really, as a new professional, when I supervise students and new professionals, considering yourself to be an ambassador for the profession is important, and knowing sort of how to communicate about that. I mean, to me, being a professional art therapist is a privilege and an honor, and people come to you with vulnerable, broken parts, and they trust you, and you create a relationship. And that's like any therapist, right? It's like a privilege and an honor to be in that relationship with that person, and you're forging this relationship to work towards their health and change and growth. But art is our superpower. I mean, it really helps us to see things differently, to help them to see things differently and experience things in a way that just straight traditional talk therapy kind of can't. And that's an amazing place to be. It's amazing.
Meredith, you are still muted. Yeah.
Thank you. For me, it's educating the field of other clinicians, the social workers and LPCs that I work with or come across, and how to express that while we don't own the art and they can do creative experiences with their clients and the people they're working with, that also. I mean, it can be valuable. So, but they're not doing art therapy because there needs to be an art therapist there. So it's kind of this balance of holding up and honoring and giving credibility to our field, which is very well deserved, while still being a warm and opening professional with others. Because oftentimes as the art therapist, you're the only one that is the art therapist. They are submersed in a whole bunch of other people. At least that has been my clinical experience. So it's kind of finding that balance between being warm and open about using creativity in your practice when you're not an art therapist, and explaining what true art therapy can do as well, what I can bring that others can't. So.
Right. Mindy.
Now, just one other quick thing. There's a saying, and I really never quite understood it, but it's the proof is in the pudding, although I don't really get it, but the proof is in the pudding, basically. So what happens is, when it gels for us as an individual, when it gelled for me, when I could see what my work did to help the individual and how that mobilized that person's strengths and also their understanding, it helped me recognize that I was a professional, that this is really what I do, and it's different than what other people do. And it's that difference and clarifying that difference, which you can add to the team, as Meredith was also talking about, that helps you with that identity that and this is my profession. You know, this is what makes sense to me because it helps others and it helps me understand the world too. So I think that's the other piece. It takes some time for that gelling to happen, where you find your niche, where you feel like you can see what the work does to help others, helps to identify and add that word in, professional. But absolutely, it also has to do with your relationship with others and how you play with it, you know, in a group, how you work well. So, but that piece was really important for me, claiming that as my title.
Great. Thanks. Okay, let's move on. Wanted to talk about, and this answers some questions that were sent in advance, and I'll take this one. Wanted to talk about the professional organizations and what their role is and why they're important. And I don't know if all schools underline this enough, and so this might be, based on some of the questions, it seems like there was some confusion about this. So as a professional, you're joining a professional community, right? And in our community, there's power in numbers. And so ADA is the American Art Therapy Association. PATA is the Pennsylvania Art Therapy Association. New Jersey has one if you work across the river in New Jersey. Just about every state has at least one art therapy chapter, association chapter. And so ADA is the national body. And when I graduated from Hahnemann, I was a student member of ADA and also what was the Delaware Valley Art Therapy Association, which became PATA. And I didn't really know why. I was told to by my mentors, and I didn't exactly know what they did. I could understand better what the Delaware Valley Art Therapy Association did because I saw it. And I'll talk about that first. So PATA is our local chapter, and PATA at this point is statewide, hence the name change, and it's really functions as the connective tissue for Pennsylvania art therapists at the local level. And so we are involved in providing information to the community about art therapy, so promoting art therapy to the general community, but also supporting art therapists in the form of educational CE opportunities, this continuing education, which you'll need once you get your ATRBC, and if you're licensed, you'll need continuing education. So we provide those opportunities. Also networking opportunities. Pennsylvania Art Therapy Association also does advocacy work in the state. So, trying to promote licensure. And right now there is a licensure movement for art therapists to create an independent art therapy license, which would be called the LPAT, the Licensed Professional Art Therapist. And that initiative is about 3 years old. Last year we got a or rather last year, 2019, we got a bill posted in the legislature, and it made it to the House of Representatives Licensure Committee, and there it rests. And then the coronavirus kicked in, and we have not been able to pursue it, so that's on pause for now, but that will be picked up again. So going for licensure, which would give art therapists a legal identity in the state as a profession, which also protects the public, which also means that if there's another profession or an untrained or undertrained person who puts up a shingle and says, I'm doing art therapy, all of a sudden now it's more than just art therapists calling them and saying, hey, can you please stop? Presently, they don't have to listen. We have no leverage. But if there's a license and someone is practicing outside the scope of their practice, the law will state that you can only call yourself an art therapist if you have the licensed professional art therapist credential. So it's really going to be huge for protecting the public, so people aren't given, counseling services under the, or therapy services that mislead them into thinking it's art therapy, where they might get inappropriate treatment, and then that can harm them or harm the name of art therapy. So there's a lot of protection of the public, and it will build out a lot of strength for our profession. So that's one thing that's been in the works and will be picked up after the pandemic relaxes or releases a little bit. We also do a lot of work around supporting members. So if there's a question, if people from the art therapy community have an ethics question and you can't get your answers, you might contact us, and we have resources. It's opportunities for networking, I mentioned. Also, we put out a salary survey, and you're going to hear some of the results. There's a brand new one that was just completed. Tina Montagna-Tate is one of our jobs research co-chairs, coincidentally, and she has facts and figures about salaries. And this work that we do sort of as a hub of art therapy then can get it out to everyone. So that's what the local chapter really can do for you. And I think that's more tangible. What I was less sure of is, what does ADA do? They were always sort of far off and doing other things, but since I've been active in the licensure movement and then on the board, I've had a lot of contact with ADA, and what they're doing is actually unbelievable in terms of promoting art therapy at the national level and creating awareness and creating opportunity. So there's so many levels at which they're working. I'll just give you one example. For years, there is a national registry of professions. And 20, 30 years ago, art therapy became listed as under the category of recreational therapy. We were a rec therapy under this broad legal, national categorization system. And now that slots us at a much lower rate than therapists and counselors. And that list is updated every 10 years. So ADA then spent years doing advocacy work with that organization that does that federal agency, educating them, teaching them and their panel, and helping them to understand what we actually do that's different than rec therapists. We're a lot more like therapists. And then just a couple years ago, they were able to transition us from that into something called, a category called rehab therapies, I believe, which is closer to what we actually do, but not quite, but it was a big step up. That's more like occupational therapists. And so we're in that same category, which slots us nationally for a higher rate of pay. And so there are several years into that category, and now ADA is continuing that push to the next goal is to have us move from that into the mental health therapy category, mental health counseling and therapy category, which is where marriage and family therapists, counselors are. So there's all this type of work at the national level that really impacts and does trickle down to employers and opportunities for us. And so, and they also provide a lot of continuing education. a lot of support in every way. So there's a lot of this big picture work that they do that we might not see on a day-to-day basis, but absolutely impacts our well-being. So that's what ADA does. And then there's ATCB, which is not, in and of itself, its role is not to promote art therapy, but it actually administers art therapy, and its name is the Art Therapy Credentials Board. So it's a credentialing body, and that's the body that really manages our certification. So they're the ones who you would apply to for your ATR. And then they're the ones who administer the board certification exam. They are the ones that have sort of, they tend almost like a garden, our ethical document, always tweaking it so that it's updated for contemporary use. And they're also the people that if there is an art therapist who is practicing inappropriately or impaired, then that is the organization that people can reach out to, and then they can hold a hearing, and people they have the leverage to maybe, reprimand someone or even cause someone to lose their credentials if they are not practicing ethically or safely. So they have a really important role in a professional development. Okay, and then the last thing that I would say is, as a professional, there are various professional organizations just in your area that you might get into. That might be population specific or issue specific. And, so for instance, I'm a member of the Philadelphia Autism Society. And I'm also in CHAD. I'm a member of CHAD, which is the ADHD support group it's national and also local. And my contacts there have helped me to learn a lot about those populations that I've come to specialize in. And then also I'm in their listservs, and I can update them and network with them about services that I provide, and also just collaborate with professionals. So that's a way for you to enhance your profession. So all of these are opportunities for you to really dig into the community, whether it's the art therapy community itself, or whether it's your local or, again, sort of the population community that you work with. And I don't see these as whims or just, things to do as an activity. I think, back to the previous question of what it means to be professional, I think that there's an imperative to be a part of your professional community. And I can't say that strongly enough. That's actually the message that I got coming out of grad school, and that's why I joined them when I didn't know what they did. And now that I've been involved in a 25-year career, they've enhanced my career immensely. And so I wanted to make a plug for you to go join us. And the way that you join, certainly PATA, and is through the ADA portal. So if you go to the American Art Therapy Association, become a member, and then you become a member of ADA, and then they have some sublinks within that where you can then join your local chapter. And you can join additional local chapters if you work in a few different states. You can become members of any chapter that you want, so you can find out what's going on in other chapters as well. So that is money, I think, well spent in its investment in your career. Mindy has something else to say, please.
Yes, just really quickly. I've been a member since I was in grad school, which was many decades ago, 1976 to 1978. And even though at times I've waxed and waned in terms of, what is this giving to me? Over the course of the years, when I look back, I think it's probably the most important thing that I ever did was to join, even though I know it's costly. But you have liaisons for information, what's happening in the field, especially now with licensure efforts, also educational things, which are really critical. And the other piece too is just developing relationships with other art therapists, which especially now, since many of us are working virtually, we really need that. So it's like a critical thing to do. We were basically forced in grad school. We didn't have a choice. We were told you have to join. But I do think it's really important to do that. And also with our organization, I am the newsletter chairperson. I forgot to mention that before. And you get a newsletter, which also gives you information about people locally. And, you know, we are a tribe, so to speak. So having those connections is really, really important. Another plug for joining.
Yeah. Any of our other panelists want to chime in any way on the issues? It's okay if you don't. Okay. Great. Just regarding trainings, there are a lot of general mental health trainings out there, but we are a big minority as art therapists in the mental health world. And so if you want to really hone your art therapy skills, there are very few places where you can get sort of cutting edge art therapy specific training. And so it's those art therapy organizations that really provide them too. So staying in touch that way. And there's power in numbers. So more the merrier. Okay. Now, let's get into some of the questions. There we go. So one theme, as we started to pull all of the students' different questions, there was one whole theme cluster around job hunting. So we wanted to really dig into that and start to help you think about, okay, I'm in school, I'm getting out there, how can I best hunt and land a job and hopefully have it be a good job with the best pay possible? So the first question is, what are the best ways and places to network? And Megan, you're gonna take this one.
Yeah, so I think just building off of what you just last talked about, the professional organizations are a good place to network. Your internship experiences, using the people that you meet through those are a really good place to network. I know a lot of people land their first jobs through their internship experiences. I don't know if this was part of this question. Another question was about like places to work beforehand. So if you work in any kind of mental health setting beforehand, those are good places to network too. And through your professors and schoolmates as well. I don't know if that covers everything. If anyone else on the panel has other ideas about how to network. Another tip I got from someone when I was networking was if you talk to somebody, maybe they don't have a job or they're not connected necessarily to being able to hire you, but after talking to any sort of art therapist or mental health professional, if you ask them, you know, who else can I talk to? Trying to get a contact from each conversation that you have so that you can sort of like build this network or build this chain of communication and keep talking to more and more people to try to find a job opening.
Mindy.
Another thing that I think is really helpful, when I first graduated, I actually, because of the area of interest that I had clinically, I was outside of the field. I went to conferences that were international conferences for my specific population and also local conferences. And the other thing, which I know is hard to think about, but when you write that thesis, write it up and present it somewhere at a local conference. So, and you don't get paid to generally do that, but people then hear what you do. And very often jobs don't have 5 art therapists. They might have 1 or they might not have any. And we'll talk about this a little bit later when we talk about practices that don't have art therapy. But going outside the field and presenting your work, just present your thesis work so that people get to know you. You have a card made, you bring your card, and you never know. I still get people who say to me, you know, I saw you presenting in 1982, you know, are you still accepting patients? So that's another thing. Go outside the field, be bold, and present whatever your thesis is about so that people get to know you. Write an article, for example, even for the newsletter, things like that. People get to hear your name and they remember you when they need a job or when you want to apply or propose a job. That helps too.
Mm-hmm. Great. Let's go to the next question, which is also a Megan answer. Will employers hire art therapists without the ATR-BC? Or
Well,
like
the short answer is yes, because you have to start somewhere. I only recently got my ATR. I still don't have my BC, but you have to accrue hours and experience in order to even apply for the licensing and credentialing. So yes, employers will. A lot of times on the job posting, they might say that they're requiring a licensed person, or sometimes they're saying that they're requiring a certain number of years of experience. So I encourage you to count your internship experiences and other experiences within the field as experience, and not let that deter you too much if you're applying to things.
Right, and just, yeah, so we're gonna talk out of two sides of our mouths here. When you are interviewing, you should count your internship experience as experience. But when you are getting supervision for the ATR-BC or licensure, you can't count those hours as experience because it's always postgraduate. We'll talk more about that later. But in this case, for job hunting, you have 2 years of experience if you have been in grad school for 2 years. If you're a decelerated student, then you will have 3 years of experience. Okay. Next question that came in was, what do employers want in a cover letter? Megan and I will take this one. Do you want me to
go first, or you want to go?
You can go. So I've been an employer, and you've written a cover letter. So why don't you go first, and then I'll talk about the.
Okay. So the way that I've kind of done it is I've had myself sort of written a base letter that I edit depending on the job posting. So I try to include a little bit about my story and passion and what I like to do to kind of give some personality to the letter. But then I always tailor something within the letter to show that I've read the job posting, that I can call out specifically kind of a skill or experience with a certain population, to kind of show what I can bring to the position, and also that I'm not just sending out a blanket cover letter to everyone. I've personalized it to that job posting. The other thing that I found I've had success when I was applying is that job postings come up and sometimes they'll stay up for 30 days. But if I saw a job posting and it came up that day, I would always try to apply immediately that day, because I think they get flooded with applications and they're not necessarily going to go through them all. So if you see something that you're really interested in that you want to apply to, try to get it in as soon as possible and tailor that cover letter to the job posting.
Now an interesting secondary, just to build on that, if you see a job posting that's been up for like 4 weeks or 6 weeks, that may mean either that that's a really bad job and none of the people are taking it, but also they might not have found the right person yet. And so don't hesitate to at least check in on that. And so just a thought. So you can certainly jump on that if it looks like a good population for you, but then simultaneously, you want to be assessing the goodness of fit. Like, is this going to be a good place for me based on the way they interact with me? And then as for cover letters, as an employer, what I look for is, for one thing, writing. If there are errors in it, that's already going to bump it down lower. So make sure that you are proofreading or have someone else who is a good writer proofread for typos, just word choice. So you want it to be very professional in the writing. I can't say that enough. I've had some people who had very nice resumes, but the cover letter, in fact, for one position, I had 2 people who were almost sort of similar profile-wise. They both interviewed well. What was the deciding thing? One person wrote well and the other person didn't. So make sure that you're presenting yourself well in writing. Second, so first paragraph, I sort of think of a 3-paragraph structure. The first one is just general intro. Hello, this is me. I'm interested in this position, and I have X amount of years of experience, and so on. Second paragraph is where you want to put in, I think, some of yourself, and some of those things. Think about your resume is going to be like the facts, right? The resume is just facts. This is where I've been. This is where I studied. The second paragraph of a cover letter, I'd like to see a little bit about your passion. You know, why must you work with this population? Why are you determined? Also in that second paragraph, I would want to hear, what are some of your personal traits that are not going to come through in a resume, right, which is very dry. So, you know, your determination, your how you can work really well both independently and be a great team member, communication skills, whatever your strengths are that are sort of your personal ones, that second paragraph, put it in there. So your passion and your traits. That's what I want to see. And know yourself, and you want to boast in a non-bragging way, right? So you want to be very confident, say, I know who I am. And then the third paragraph is where you do a conclusion where you state, again, like, you know, I understand the needs of your population that's being advertised for. And because of all of my above traits and passions, I'm certain that I will represent your organization well. I'll work beautifully with the clients, and I'll be an asset to your team. So any of that type of language you want to put in that closing thing. And then I would like, important, this is a selling letter. You're selling yourself, so you want to close the sale. I would like to schedule an interview with you. Please contact me at your earliest convenience to schedule an interview. Right? That's the ask. That's a powerful cover letter, and I would really respond to that. Those kind of cover letters already bump someone up into like an impressive category for me, in terms of early sort of screening. If I have a comparison between candidates. Okay, next question. Besides my school internships and prior jobs, what additional experiences do employers want to see in resumes? And let's see, Megan and I will take this one.
Again, I think we're building on previous topics, is maybe membership in professional organizations. If you work in other mental, like as a psych tech or things like that, where you're working in the mental health field, not as an art therapist, but still kind of having contact with the population, those are always really good experiences to have as well. Any kind of presentations you've done, any school club membership or other related things that you've done within school are also good to have in there, I think.
Mm-hmm. Right, which means, so not only should they be in your resume, but, you know, if, let's say, you know, you have a part-time job, if you can, I think, try to do some volunteer opportunities with certain populations that may not even be your specific clinical population, but the same age group, perhaps. You know, and so, like, if you have a resume, it doesn't really help your cause to have, you know, like sales, you know, restaurant, you know, service industry experience on there. So it's better to have just a few jobs, but then have a few additional things with your population or with the age group that you're planning on working with. So I would rather see, rather than like, you know, barista at Starbucks, I'd rather see, you know, I worked for, you know, 10 years, so I work with kids and I hire people who work with kids. I want to see that you worked in day camps for 7 years. You know, that would be something that would help your cause. So you just want to think of, you're shaping the mind of the reader, the person who has hiring responsibilities. You want them to think about, you are the ideal candidate. And just if you do that, that'll guide you in terms of the things that you put into your resume. And therefore, if you are trying to get a job with different populations because you don't have one population that you're set on, you should have one resume that's, you know, let's say you want to do geriatrics or the DNA population, then you want to have a resume that like skews towards that. If you want to work with kids, have a second one that skews towards kids. You know, so that way you don't come off as just a generalist. You really are highlighting the package that you're going to bring to those respective populations. Okay. And yes. Oh, and one more thing. Even as you continue to work, go out and get certified in things that build your expertise, build your total package of what you bring. So let's say you start off and you're working in the field for your first year or two. If you start to work with the population and you'd like to get certified in trauma-focused CBT because you're seeing a lot of trauma clients, that's not art therapy specific, but now you have a certification, right? If you, so on and so forth. So looking for certifications in your area or tangentially related to your area will really make your resume pop and see like, oh, this person has this additional training, right? So look for continuing education even after and during your first job and beyond to get certified. All right, next question.
Hey, Mike, before you go on, did you see a message in the chat? Somebody's waiting to be let in.
I did not see that. Hold on. Oop, thank you. Appreciate that. It's hard to MC and be tech as well. Next question is Mindy. How does an applicant approach programs or practices that don't currently have art therapy in an attempt to be hired and start a program?
Okay, of course, I've been waiting for a call back from Apple for 5 days and they just called, but I will answer this question. This kind of tailgates on the comments that Mike was just mentioning in terms of experiences and what do they want to see. When I got laid off from Friends Hospital after 18 years, I was really blown away about how I was going to find another job. And these were the olden days, and we didn't I think I had a computer, but we didn't do jobs through internet kind of things. I remember I sent out 100 resumes, and my resume is like, at that point I had been working in the field. I had multiple publications, multiple international things. So my CV was at least 13 pages with all kinds of amazing things on it, okay? Nobody even responded to me. Like no one even bothered to answer, and respond and say thanks or give me a call. And I was really blown away. I wasn't sure what I was going to do. And I had a colleague who also was, had been laid off. She was a dance movement therapist. And we were all laughing when we were talking about this the other day. And everybody agreed, don't do this. But I'm just saying, what I did at the time was I had some really funky cover paper. It had happened to have rainbows on it. And I wrote a letter to University of Pennsylvania, basically telling them that I was going to develop something for them. It was not a job that was posted, but that I was going to work together with a dance movement therapist, and I pitched a job. So what did I do? I convinced them that I could offer these long-term structured residents opportunities for things. And I used buzzwords after looking at the program and what they did offer. I picked some of their buzzwords and incorporated them into this letter, and then a one-page CV, little resume kind of thing, about the skills that I could bring to that job and how art therapy was going to offer them something different than what they already had. And they called me. So, I know that there's not sort of a catch-all of what you need to do specifically, but you have to let them know that you can do something that someone else cannot do. And that you can offer the clients, and particularly right now in this world that is filled with horrific trauma after last night and what happened over the weekend, last week, offering them that you can offer them something that no one else can offer, that you're a team player, and this is how you're going to do it. And as Mike said, you want to go in for an interview, or at least a virtual interview. So it's that you can do something different and present to them 3 or 4 bullet points as to what that is, and also how you can integrate with the team that they already have.
Yeah.
You have to sell yourself.
Oh, Meredith is that your hand? Yeah, Meredith's going to add on.
Yeah, I wanted to say, in my 15 years of experience, none of my jobs have ever been listed for art therapists, please apply. right? I have applied to social work jobs and clinical, counseling jobs. I get in there and I'm like, wait a minute, I can do everything those people can do, but I have this other amazing thing that they don't. And these are the ways that I can help your agency or your whatever it was. And going back to the training, so I'm certified in dialectical behavioral therapy. So the DBT and those trainings and things all played into the future jobs that I got, with like domestic violence and things like that. They knew they could count on me as a clinician in those things because of my trainings, but then I had the art therapy that I could use in this amazing way. So I don't want anybody to not apply for jobs that are out there for beginning level social workers because you can go in there and tell them, yeah, I can do that and this, and it really can really make us stand out. So I just want to put that out there.
That's the key. Yeah, we are cross-trained, so our base training is very much similar to that of counselors, to clinical social workers, and all those other master's level professions. And but then we have this additional component that no one has, right? So go in and tell them, I can do your job plus, and this is what I'll bring. And that actually leads to the next question, although something, hold on. Yep, there you go. There's a chat. I'm also monitoring. So a student came across grant writing requirements or grant reporting requirements in a job description and was curious if any of us knew about that. And we had to do a little research because on first glance, none of the panelists did know, but I did get some feedback. So a couple things about grant reporting and grant writing. So this builds on the previous question. Sometimes you can write a grant to various grant writing funders, grant funding organizations, whether they're nonprofits or even governmental, and they will fund your program. They might fund salary and materials, possibly, for you to run this program. Now, but you can't write a grant without an address, so that means if you have an idea for a program, you would then need to write it up in a formal proposal, and then you would have to hit the bricks, hit the streets, and go out and propose that to various mental health or wellness organizations and say, not only am I doing this, I'm not going to ask you to pay for it, I just need a place to do it. I'm going to, if you can endorse this, if you can get behind it, I'm going to go do the grant writing. And then you write the grant. But you can't, it's sort of a chicken and the egg thing. You can't write a grant without a location and a place to do it. And like a letter saying that they are going to host it. So that's the sequence that you would do there. Then once you have a grant, anyone who gives you money to do something is going to want documentation, some sort of evidence that what you're doing is important or impactful or successful. And so that's what grant reporting requirements are. So it's possible that if you get a job that has grant reporting requirements, that means someone else wrote the grant. They have this opportunity for you to be hired under it. And two things. One, you're then going to be responsible for writing up some of the feedback or outcomes from the grant. And they may have a form and structure for that, or you might have to create it. And the second part is that, just so you know, grants can run out, or a grant funding organization may decide not to provide that grant the next cycle, the next year or so, whatever. So you have to reapply for grants. They're usually time limited, not ongoing. So just so you know, and but that is another way for you to get into agencies and for you to create and promote a unique program that you develop. Okay. The next question was about power words. What are some examples of language, and how do you word what we do in a way that translates to employers, including resumes? And we have a quick answer, and actually we wanted to encourage students, everyone, to chat to the group, chat to all. What are some power words or phrases that you use to talk about art therapy? And we'll be able to, at the end of this, we have a copy of the PowerPoint to send you, and we can also send you a copy of the chat to all participants. So you can have this list of sort of power words. So think about what are some of the most effective words and phrases that you use to describe what you do, how we do it. But my answer, as you're doing that, my verbal response is, when you're talking to an employer or writing a proposal, it's all about them, or more importantly, their clients, their community. What's in it for them? What's in it for you? That's what you want to say. So yes, you want to say like how art therapy is great, but it comes off a little shallow and a little bit salesy if you're like, art therapy is great. We have the benefit of permanence, and we have the creative process. That's good. But what's in it for you? How's this going to benefit the people that you care about, right? That's the big picture answer to that. Okay. So what's in it for you? And that sort of partly depends on the job, right? On the position and the population. But if you're talking about geriatrics, then you want to talk about all of the great things that art therapy is going to do uniquely for the geriatric population, and how it helps their developmental levels, right? Let's say they have to work on generativity and life review. How does art therapy do that? If you're working with a prison population, what can art therapy do for them in terms of self-expression, mood, decreasing, suicide, and so on, and aggression in the jails, and on and on and on. So what's in it for you? That is what you want to brainstorm and then write up. And everything else I think you have from your grad school. Use Wadeson's benefits of art therapy, and that's the overview from that. Any other panelists have any just other words you wanted to add to that? Good thinking, it's okay. In the interest of time, it's also okay for us to move on. Make sure we get to everything. All right, next series is about salary and negotiation. And so some questions were, what are some of the typical salary ranges? Nonprofit, community, mental health, hospital, private practice. So let's go to that. And Tina, who did our jobs research and put together the presentation, let's have it go to you.
Okay.
And you can share, and I don't know if you have a screen to share, if you're just going to do it verbally.
I'll just do it verbally. I went through, so
Okay.
PATA does a biennial salary survey. And if you want a copy of the whole survey, it comes complimentary to you if you're a member of PATA. So that's another benefit of being a member. But I did go through the results, and I'll just recap them briefly for the questions that you guys posed. We surveyed 650 art therapists across the state of Pennsylvania, and 152 responded, which is pretty good for a survey like that, but it's a small sample size. So it's not super representative or super generalizable, but it's just to give you an idea sort of what the information was that came back to us. 33 people, 22% of the people who responded had 0 to 4 years experience. So I kind of looked in that area for new professionals, and 65% of those were in the $30,000 to $49,000 salary range. We asked people to select a range, being I think that's a little bit more palatable when you're talking about your income. But so 65% are in that $30,000 to $49,000 range. Not exactly sure of the exact numbers in there, but that's the most frequently selected range. And a few 20%, which was the next greatest number, were in the $50,000 to $79,000 range. These figures are helpful, and having a copy of the report is helpful when you go in to negotiate for salaries, if you have an understanding of sort of the community around you. Breaking out into these other subgroups is tricky. I did it with help, and the sample sizes are minuscule. So these are like, we're talking about 9 people, 8 people, 7 people. So again, not representative, but just to give you an idea what the common factors were. So how I could break it down was sort of inpatient work, outpatient work, nonprofit work, education, K-12 education, secondary education, and private practice is how I could sort of break it down. And in most of those, there were, let's say, a number of people in that $30,000 to $49,000 range, and then another group of people in the $50,000 to $79,000 range. So it looks like most of us, right? I mean, that's a big range, 30 to 80, but in there, it's generally speaking. So inpatient, there are 9 people in the 30 to 49 and 7 people in the 50 to 79. And the same thing goes pretty much for outpatient, nonprofit. Education, K to 12 was too big of a scatter to lump anybody. There were people all over. And I should say, what I'm giving you is the most commonly selected range. There are people at the lower end and people at the higher end. So there was a scatter otherwise, but there were these little concentrations in these ranges, making them probably the most, common ranges. Education, college was a little bit inverse. There were that group of people was solidly in the $50,000 to $79,000 range. And in private practice, it was also reversed, that there were fewer people, but still a lot of people in the $30,000 to $49,000 range, and then a few more people than that in the $50,000 to $79,000.
Mm-hmm.
And that's a lot of numbers, but if you want to look at the report, you just be a member and it'll be emailed to you.
Yeah, so definitely, join to get access to that. But the main takeaway is that in a bell-shaped curve within that range, so of the 1 to 4 year people, so new grads to 4 years, most likely you're going to be slotted in the $30,000 to $50,000 range. But within that, probably some median type number. So probably upper 30s to low 40s is your most likely bet, which takes us to the next question, which is effective salary negotiation. Oh, Meredith, did you have
I just wanted to, I don't mind sharing for people that first job might be a bit difficult, but in the 15 years, I could say my salary has more than doubled, almost tripled. So hold on to hope that you will not be, at that same salary. There is possibility in our field for growth and movement upwards in that way. So I just wanted to say that. So.
Right. The most important thing is getting the first job. It's a hard position to be in, to be interviewing when you don't have a salary, because then you're more desperate, right? Once you have your first job, then you have the security of a paycheck, and then you can do a more leisurely, for your second job, you can do a more leisurely search where you're really scanning, you interview, and you're like, no, like that'd be a step down for me. So then you have the leisure, and I think the leverage to really, look for a better job. But the first job, you want to sort of start with, when you're thinking about negotiating, first of all, you need to think about your budget. Like, what do you make? What are all your bills? Because you can't take a job that's not going to pay the bills. So first you have to start with what you need, and then you're probably hoping to save or have additional, discretionary money for fun and for vacation. So sort of creating a budget for yourself, and then you go out and look for a job. And when you go to negotiate, you want to start from your professional identity. You are bringing something of value. And so when you go in there, you really want to try to have the other person across the table give the salary first. Often jobs will try to get you, the interviewee who's anxious, to say, they'll say, what are you looking for? If you say that, you might say, oh, I'm looking for 37,000. But what if that job was slotted for 41,000? You've just automatically cut yourself out of $4,000 by you talking first. So we want to structure the conversation and sort of just be strong. And if they say that, you can say, well, I'll be happy to tell you mine, but what is the salary range for this job? So you can flip it. So I'll be happy to tell you mine, but what's the salary range? Can you tell me that? See if you can get them to go first. And if they say, oh, is it 41,000? Then you say, I was interested in 43,000, right? So then, you can ask for a little bit more than what they're asking to see if they'll actually go up, because even if they give you the salary range, their upper number probably wasn't their highest number. So that's one salary negotiating trick, is to get them to talk first, okay? So sort of have that, and maybe you can pre-write some of that language, sort of script it out and rehearse that for yourself when you get to that. Secondly, just another important thing is say like, when they give you a salary number, you don't have to agree to it right face to face. You can say, okay, I'll need to take this into consideration and think about it. Then you leave, or if it's a Zoom, obviously these days, and then hop off the call. I need some time to think about it. Can you give me 24 hours? So then you make them sit with it. They've offered it to you. They're interested in you. And then you can go back and then you offer a counter, which is a little bit higher. And so we'll talk about that in a minute. And actually, that leads to the next question, which is, I heard that you can negotiate other things besides salary, like vacation time and training reimbursement. How does that work? And so Meredith, you had some thoughts on that.
Yeah, I think that just an honest discussion with them, what would be the reasoning that it would work for you better with different hours or what that it is, and know that that might not be negotiable, right? If I work for LVHN, the amount of years and how many hours you work each week, there's a chart that says exactly how much PTO you're getting, and it would seem strange if I said, hey, can I have 4 more days than everybody else there, right? But there is some flexibility, say, in my schedule, when it works for, my outside life and things like that. So there's some flexibility in there. Certainly if you're working for an agency or a program, you're working for an IOP program or something like that, and the hours that the clients are there from 7 to 3:30, and you're like, well, I'd like to leave at 1 every day, that's not going to work. So there's some requirements that will just be there inherently with the position, but sure, a conversation can be had to negotiate some of those things too, if you would need to.
Mm-hmm. Also, when you're hired for jobs that have benefits, there's a total package. So the employer is not only thinking about salary, but they have other additional costs, such as, health insurance or your retirement fund that they would contribute to. Also, if they're hiring you and you don't yet have your ATR or BC, and you're going to have these costs, and you can say, do you provide, will you have someone on staff who is an art therapist who is an ATR BC who can supervise me? If they don't, that's going to make it harder for you to you can make a claim to them that's going to slow your process of becoming credentialed, which is what they're going to want you to be. So, right, so you can say, can you provide me, here's my salary. Can you also provide a fund for me to get my ATR supervision? You might have to go out, find a supervisor, find out how much they cost, multiply that by a year or how many sessions you're going to have, come back to them. This is what I'm going to need. I have a student for this year who did an amazing job at negotiating, who she is still on her parents' insurance, and this job offer that she got was going to provide for health benefits. Well, she wasn't going to need their health benefits, so they're allocating, thousands upon thousands of dollars for that position's health benefits. So she went to them and said, okay, this is the max salary, but since I don't need the health benefits, can you, include some of that in my salary? And they wanted her, and they raised the salary. So that's an example of having this total package of all the benefits that the job offers, and there's some play there. So if you don't need something, you can ask for more. Can they provide continuing education? So I had a job that I thought I was not paid enough relative to everything that I was going to be doing for them, but they had a really robust continuing education plan. And they paid an additional $1,000 of continuing education per year. And so that was essentially a raise on top of the salaries that I wouldn't have to spend out of pocket. So that's what you want to think of when you're negotiating. Okay.
Mike, can I just add one thing? And that,
yes, please.
That's that when you go in for a first job and you really want that job, you don't really have to agree with everything in the moment because you want that job, but it's really super important to be professional. I think what Meredith was saying about having direct professional communication with these people and conversations is super important. I think unprofessionalism is everywhere. There's a lot of it, and you can use your professionalism to stand out in a way that is impressive and benefits you and our field in general. So even if, some of these negotiations may feel uncomfortable initially when you're first going to a job, but you're presenting yourself as a professional, and having these conversations may be challenging, but is definitely to your benefit. That's all. Just want to add that.
And one very important thing to say in all this is that when you're looking for a job, especially the first job when you're starting from a place of not having a job, then there's a little more sense of need on your part. And you might forget this really important fact that you're looking for goodness of fit between you and the job. So if the job says, hey, we're going to pay you this, whatever, but you're going to have to work 40 hours a week, including Sunday nights till 10 o'clock, and you have family commitments or whatever, that job might not be the right job for you. If there are certain demands, or even if a job comes off as really disorganized during their process, if you are talking to a job for the interview process and they're really disorganized, or there's any kind of attitude or anything that just raises red flags for you, you should be concerned that that's top down and there's something that could be wrong with their system. And so that job, which might be the right population, and they might even offer it to you, you might want to think about, is this going to be the right fit? Or but it might be a symptom of a something systemic that's off. Mindy.
Quick thought, and that is, again, what is the main goal that you're having for this first job? And that's, one is survival. Obviously, we need to make money and we need to live. The other piece is what made me decide between the original offering of a job at Pennsylvania Hospital versus Friends Hospital was that I was going to have more direct hours doing art therapy, being involved in that process. And that even though the salary wasn't exactly what I wanted, and in those days it was $11,500, and that was okay, I could live on that at the time. But most importantly is that I was going to exclusively be involved in doing things related to art therapy, assessments, groups, and individual work. So if your goal, which I think is really an important one, is to get your credentials so that you can then do other things and be where you want to be and get that ultimate job that you want, the goal would be to be in a system or be in a place where you can do what you're trained to do, so you can get the credentialing that you need to go on and then be in exactly the place you want to be later on. So for me, that Friends Hospital job offered me at the time, and maybe even still, it was the cream of the crop in terms of education, art therapy, supervision, on-site supervision, but of course I also had an off-site supervisor. And all the things I needed to create a platform from which I could then see what, come up with my own vision board for where I wanted to end up. So sometimes you'll negotiate in your own mind what you're willing to give up, which might be a bit of salary or the perfect location for the amount of work that you're going to be doing directly in your field to get the credentialing you need to go do what you want to do. And for me, I think that's probably the most important element, because you can get paid a ton of money, which is wonderful, but if you're not doing direct art therapy services, it's not going to matter, because you're not going to be able to get the credentialing you need. And eventually, places are going to say, as they are doing now, you really need those credentials. So you can worm your way into a position without the credentials because you're on board to get them and you're collecting your hours and all these things, you can let them know. But if you're not on that trajectory, then ultimately you will not be involved in art therapy because you won't be able to get your credentials. So you give that up if you sometimes, so you have to make sure what's on board for you and what's most important.
Yeah, great. Tina, what if I can't start on the day that my employer wants me to?
That's, I think that's a really specific question that we've kind of answered. I mean, in terms of having these conversations out front when you're in a interview situation or they're offering you a job, if you have something, you have to give notice at another job, you have a vacation already planned. I think it's just important to be respectful and professional and come out, in front of that and let people know. It's just a matter of having those sort of direct professional conversations.
Mm-hmm. Yeah, and then again, it's goodness of fit. And if you truly can't go, if whatever it is you can't get out of, they say, I'm sorry, like I can start, 5 days later. If they say no, then that's not goodness of fit. Timing is also a part of the goodness of fit. So, and I see Mindy has a hand up too on this one.
Yeah, the idea is just to do that at the very beginning, though.
Yeah,
so
right up front.
Right up front. So when you're going for that interview, you let them know that you have this already planned, because they haven't actually offered you that job, or if they have offered you in that moment, if they happen to offer you the job. If you put those things up front, it's much more professional than starting the job and then going,
Right.
oh, by the way, my family and I were going to do this or that. That is not a good thing. The other thing is, honestly, how badly do you want that job? So if they say you need to start a week from now and you really wanted to do 2 weeks, well, in this day and age, if you want that job, you might just decide, well, I'm going to do that. And in your own mind, you might say, great, I can start on this day. However, I already have a week planned, whenever that is. So be open to doing that. If the job is a good fit and you really want the job and they offer you art therapy and the other things you want, you might have to back down on something on a start date because you want the job.
Yeah. Mindy, I liked a phrase you used before, which is you sort of negotiate with yourself as well. What am I willing to do for this job? Is this job worth it? So you're weighing that. Last question in this segment is, what's the difference between being an employee and an independent contractor? Is that fee for service? I'll take this one. That an employee versus independent contractor is that's an IRS classification, actually. It's legal in IRS. And there's two different things, and that has to do with the way that taxes are taken out. And so is that fee for service? You can be an employee and be fee for service, or you can be an independent contractor. So that's two different things. So fee for service work means you only, you get paid for the clients that you see, but that you still could have benefits and you still could be considered an employee. So an employee, the company is required to take out taxes, and they also pay into, they don't take out taxes, and taxes are taken out for, various, levels of government, and they're required to pay into your unemployment as well. So there are some additional things that they're required to do when you're an employee. As an independent contractor, you are responsible for paying your taxes. They do not take any taxes out. You get a salary, and then you are responsible for keeping track. You may be working with an accountant at first, just to help you set it up and to know that you should take out X amount, and then you would pay quarterly to your state or federal taxes. And so then it's a different responsibility there. It's helpful, again, if you're doing that, to have an accountant just to set up your structure. And then once you have it set up and you've done it for a couple of months, many people can be independent with that. And the other big difference between being an employee and an independent contractor from an employer side is an employee, the employer sets the hours. They have rules. You show up at a certain time. They're providing the institution and the time and the materials, and they take on all the risk of whether or not there's work for you. If you're an independent contractor, some of the things that go into that are you must have your own insurance. You are, again, paying your own taxes. You take the risk of profit or loss. Like if they don't have work, if you have a contract, there may not be work for you. There might not be enough referrals. You're paying for your own materials like office supplies. You're paying for your laptop, for your wireless, for your phone service and so on. So all those things, now those you're paying for them, but you can write them off. Those are deductions in your taxes as well. So there's a lot more to it than we should really get into at this stage, but that's the basic difference between being an employee and an independent contractor. You can get benefits, health benefits, and all those other things if you're an employee. If you're an independent contractor, you're buying your own health insurance, malpractice, and so on. And you can leave it at that. You can also look up more information about that just with a simple Google search. But that's the most important stuff for you to know about that. Okay. last section of pre-sent in information. We have 25 minutes left of our time. So let's see, panelists, if we can go quickly and still have some time for Q&A. So Megan, what specific licensure should be pursued in Pennsylvania? Are we required to look for a specific job that has a supervisor on site with particular licenses like ATRBC and the LPC? Oops, there we go.
Yeah, so most people do pursue, currently, as we're trying to get the licensure in place for art therapists, pursue both the ATRBC and the LPC. You are not required to have an on-site supervisor with those licenses. You can get off-site supervision, and as we were discussing this, Mindy even recommends having somebody off-site, which I agree with, because I get half of my supervision on-site and half off-site, and there's just more that you can, sometimes you get a better perspective from someone off-site, and you're able to bounce things off of them a little bit easier without the maybe worry about what a direct employer or supervisor that at your job would think or say about something. So I would say when you're job searching, it's not a requirement. I think that if, like looking back at the salary negotiation piece, it can be beneficial financially if you're able to get free supervision, if that's important, but it's just kind of an aspect to weigh.
Mm-hmm. And right, so one thing to think about in those early years, if you know that you're going to want to get the ATR and BC, then you should certainly be working with a supervisor who has those credentials. Double that. If you think that you're going to want to get the LPC, the Licensed Professional Counselor credential in whatever state you're working in Pennsylvania, you must from the jump be supervised by someone with that credential. So ideally, if you want both of those, you would need to be working with a supervisor who has both their ATRBC and their LPC, because you could get your ATRBC with 1,000 hours of client contact, 100 hours of supervision, and if they didn't have the LPC, when you go to the LPC, they're going to make you redo all those hours with an LPC supervisor. So there's redundancy, wasted time and money. So absolutely keep that in mind when you're looking for supervisors.
Mike, the other thing that's nice about Pennsylvania is that the ATRBC exam is an exam that they will accept for the LPC application. So that's nice to know.
Right.
One exam, 2 credentials.
Yes, for sure. Yeah, Pennsylvania, that was written into the LPC law that they accept the BC exam. So you can take an exam in our specialty. You don't have to then learn the entire LPC, playbook in order to take their test. Let's go to the next question. What are the needs, Megan, what are the needs that must be met in employment after graduation to satisfy both ATR and LPC licensure? We just did that. We talked about, for details as well, go to the ATCB website, Art Therapy Credentials Board, atcb.org, I believe it is. And there they have very specific requirements. They walk you through what's expected. So we already answered that question. Megan? Mindy, I've heard that sometimes art therapy is viewed as more of a rec therapy and not a quote unquote real therapy. Is it better to get your LPC and bring art therapy into your practice, or should you get your ATRBC?
I still think you should get your ATRBC. You can do it simultaneously, but again, it comes down to what you want your identity to be all about. So I wanted my identity and maintain that that's really important, to get your credentials in our field, which is what you're trained to do. And you can simultaneously accrue hours for the LPC as well. But I do think it should happen that way first. Yeah, I think it should happen that way first. That's our identity.
Yeah. And again, it seems as though, based on the slotting that I talked about earlier, rec therapy jobs tend to pay less than counseling. So if you're trying to push your way, push into the field, and we said go apply for jobs that are for counselors and clinical social workers. those populations, those professions, because you go in there, you say, I can do all those things. Plus, we have this visual communication and creativity piece. That's going to be slotted at a higher rate than rec therapy.
The other thing, Mike, is I don't know, again, I don't have experience with this because the jobs that I had applied for were art therapy positions, or I created one. And Meredith, maybe you could speak to this, since you said that you also, the jobs that you applied for were not necessarily for art therapy. But if your title is not art therapy, my question to the rest of the panel as well, or anyone else might know, I don't know whether or not, even if you get in under the auspices of a rec therapist, and again, I think the pay is less, because very often they are not, and I think it's TR now, it's therapeutic recreation person. They have credentialing as well. But if they're going to want you to get that credentialing, you're not going to be able to do it. But I don't know if we go in under another title, like activities therapist or something along those lines, if they have an art therapist on board, or you are allowed to create your groups with an art therapy format, and you write up your group in an art, this is basically art therapy, you could potentially get hours if you were being supervised. But I think you have to be really careful. So that is part of the problem. And again, your identity isn't really going to gel if you're calling yourself a rec therapist, even if in your heart you believe you're an art therapist, because you have to sort of keep that quiet. So yeah, it's really different. It's very different. And again, based on your own philosophical orientation to what you do, rec therapists don't necessarily do that, even if it's trauma-informed CBT art therapy or bilateral art therapy, or whatever else you do. So I think that you need to be clear on your identity and what it is that you can offer, and find a job or create a job and make them change the title of that job.
Yeah. And they might not change the title right away. Maybe you're there for a year, you work, sort of in their structure, and you say, you know what, do you like what I'm doing? Could we change the title? And then you can sort of evolve it. So when you're a new person in a job, you have no clout, so they don't know what you offer. So it's hard to make that ask. But certainly if you're there and they value your work, then you can say, let's turn this into an art therapy position.
The other piece, though, is that in some way, whatever it is you're running, your groups, if you're working with, again, an outside supervisor, which I think is, in my day, you had to have an outside supervisor. You weren't, the supervision on the job did not count for art therapy, for our credentialing. So evidently that may be a little bit different now, but you are capable then of addressing things that you can't address on the job, as to how to work the system, which is really hard to do with your boss directly, how you're going to work the system. So you can do more of that with an outpatient, outsourced art therapy supervisor. But you also, as long as that supervisor, and you can verify that you're working in an art therapy framework, then I would imagine you could collect those hours. But I love your idea, Mike, of then once they really recognize, you really are performing and working as an art therapist, they might be willing to change that title. I think the issue comes into licensure right now and what they're going to get paid for. So I'm finding with more supervisees that sometimes that's a bit of a problem, that if you're, if they're not willing to grant you that title, then you may have more difficulty on the back end for credentialing and or changing the title at a later date. And they may say, well, our therapists are not licensed. So that licensure piece is going to be really important. Mm-hmm. Once we get that, I think jobs will be able to say, we want an art therapist.
Yeah.
They can get paid.
It's going to create so much opportunity.
Which is why if you get your ATRBC, and then you can be grandfathered in once our license goes through, which I think is happening in New Jersey right now. I have to double check that, but I do belong to them as well. And I've been getting emails that grandfathering process, I think, might be starting now. You'll then have a license in both, which will be great. So yeah.
Good stuff. Tina and Mindy, how do you find a reliable supervisor for your hours? Is there a site or place where you can vet potential supervisors? And what's the going rate for supervisors, for supervision?
Well, I can talk to what we got on the survey for the fees. 63% of the people were provided with on-site supervision. And people that were paying for supervision, about 45% of them paid between $40 and $59 for an hour of individual supervision, and about 25% paid $20 to $39. There were some that were more expensive too. I say, I'll let Mindy talk more about how to find a supervisor, but I think looking at your experiences in grad school, see if any of those people supervise privately or become a member of your local chapter. When a lot of places will have lists of supervisors, clinical supervisors. And I wonder if you want to add something, Mindy.
Well, the other thing is sometimes I will get an email from someone who's, again, attended a workshop that I have presented at, or even through something like this, where they've heard me at a venue talking about something, and they'll contact me, because the idea is to make sure that you and that supervisor are going to mesh on some level. A, does the person have the credentials to do what you need them to do? Are they dedicated to supervision? Because you need dedication to do that. And do they have enough experience in the field that you're interested in? That's the other thing, to do the job. Also, sometimes you'll have someone who mentored you, or a prior on-site supervisor who you might want to continue to have off-site, who have supervision with after you're done with the job, through your grad school. That's another thing. But I think just like finding a therapist, you call the person, and you can go to ADA and look at, registered art therapists or board certified art therapists. At conferences, you can hear somebody speaking. You can also look at the prospective agenda for a conference and see what art therapists are listed. Whenever I go to a conference, or I'm speaking at a conference, I always see who else is in the field is going to be presenting here. And I might go check out that person. So, and the other thing is, once you find someone who you think might really work out for you, if that person can't do it, but you like that person and feel this would be a good fit, they may be able to send you to someone who they also think is good. So it's sometimes word of mouth. And the idea is to find somebody who you really feel committed to, who you think you can work with and be transparent with, because transparency and supervision is critical for training, which is why I think offsite supervision is really helpful. And then, again, you might be willing to, I don't really know too many people who negotiate a fee for supervision. I know that sometimes I will shift my fee, particularly for new graduates, because they can't pay my regular professional supervision fee, which I do for consultations, which is significantly higher. But you may decide, well, I really want to work with this person, and they might be $20 more than so-and-so, but I think the fit's going to be better. And, you have to be happy, because you're going to be with that person for a while. Hopefully you'll pick the best fit first. So you interview a supervisor also.
Right, that first phone call, you're also, in addition to what their credentials are and price, fee, you're thinking about chemistry. Like, how do you guys talk just in that first call? Does it feel like I can really communicate with this person? So there's that feel piece as well.
And especially now, one more thing, in the experience of virtual things right now. So we may be doing virtual supervision for a while. That also is going to be even more important. You're going to have to be able to connect with that person through a platform like this, where that chemistry, you can feel that chemistry. Mm-hmm. And who's going to be willing to talk to you for 15 or 20 minutes in that first phone call, which is also important.
Yeah. All right, is it okay if we do the last question that was submitted, and we only have 10 minutes left of our time, so these answers have taken longer to answer. Questions have taken longer to answer. The last one is surrounding private practice, and the short answer is you can't officially, according to ATCB, our ethical document, you minimally need to have your ATR before you can enter private practice. So that requires you to get some more experience, and that's important because if you think about what private practice is, you're solely responsible for that person's well-being. So you want to have developed clinical wisdom and experience, and so you shouldn't be able to do that and hang up a shingle right away. So that's really, I think, a good thing to slow down the process. I also don't think it's great for people to shotgun through, like to overdo supervision to get their ATR faster, because yeah, you can get it faster, but are you getting enough clinical wisdom? so it's good to just work the process of your hours. So the first just baseline idea is that if you want to be in private practice one day, minimally you have to have your ATR. And Mindy and Tina, you're both in private practice, and so am I. Could you do sort of the short version of how it fits into maybe someone's professional developmental arc, and what it's done for you?
I mean, the very short, I think that you said it very well. I mean, and I would like to save some time for them to ask some questions if they have questions they want to ask. I think you said it well. I think it's going to be a while before students are at this place, and they'll have a lot of experience before they get there to sort of feel people out for that kind of stuff.
Yeah.
But I appreciate that.
There are a lot of things to consider when you're going into private practice. I went into private practice for two reasons. One, I needed to make more money. That was one. I was a single parent, and I needed to make more money. But even above that, or certainly equal to that, if I'm going to be transparent, was the fact that I could not do in the job that I was in at Friends Hospital some of the kind of work that I wanted to do, which was with a very specific population that wasn't considered. Friends Hospital at that time didn't deal with trauma, and my supervisor was like, we don't do that here. And I thought that DID, MPD was really incredible, and I loved working with these people. And I worked with a client for a year in the hospital, and in 1980, she said, will you see me? And so I was credentialed, I had my ATR, and that's how I started my practice. But remember, when you start a practice, you are liable for that person. It's not just about making money. It is that you are available. You need to have a lot of experience, and also even then supervision, ongoing supervision when you go into private practice. So you have to really recognize the impact. You can get sued. I have not been sued in 40 years. Not a lot of big wooden table I have here. I have never been sued, but that is also an issue. You can be sued. You are liable for what you do. People are watching. You have to be credentialed every 5 years in our field and every 2 years in my LPC. There's a lot of work to it. So, it requires an office, and especially now virtual stuff. So it's a lot to consider. That being said, I love private practice. I also worked inpatient for 18 years concomitantly. So at the same time, I was also doing that work. So that's another way to think about it, having a solid job where you can also have insurance. So when I lost my job at Friends, I got a job at Penn because I needed 20 hours. I needed to have insurance. So lots of things you have to pay for on your own in private practice, solo private practice. You can also think about joining a group, which might be a great way to start being involved in the practice. But I love it. So lots of work, but well worth it.
Yep. I joined a private practice and then created my own, and it's been the best thing for me, for my soul. I did it for the two same reasons as Mindy, actually. I needed to make more money for my family, my growing family. And then also I felt like I was kind of being ground down by the agency, the community mental health machine, of like all the paperwork that we had to do was very hard for me personally with my wiring, and just the lack of sort of the claustrophobic feel of sort of being in a box. And I just had so many creative ideas and wanted to develop programs and things. And so ultimately, for like both, my family's well-being and for my soul and my own emotional well-being, it's been just a godsend. And I have the autonomy to work how I want to work and create my own schedule. And I'm the boss of me, and I don't have inappropriate, nasty supervisors being punitive towards me. So it's good. And so for all of the above reasons, it can really be a great developmental move when you're ready for that. And maybe we can leave it at that and just take a couple questions. We have 6 minutes left. Sorry, listeners. But we would love to take questions. And if you also type in questions, we can when we send out the minutes or the some of the documents, we could include answers there. So we'd love to open it up to a question. If anyone, it would be most effective if you just type it in chat, so people don't talk over each other. For Megan, there's a question. During these trying times where many agencies, is it worth it to get the new ATRP provisional registration?
I personally did not do that. I don't know a whole lot about the ATRP and what advantages it might have. I'm not sure if somebody else on the panel has a better idea about that.
I think that there are some states that put a provisional level in their license. And so that really applies like in a new art therapy license, you know, in the new art therapy licenses around the country, they're saying, you know, you can only call yourself an art therapist or say that you're doing art therapy if you have the license. Well, of course, if you're still getting your hours towards the license, then by that law, theoretically, you couldn't call yourself an art therapist. So therefore, the ATCB created this ATRP. I think it really applies to those states. So that way they can say, I have this ATRP, it's in our license, it can allow me to call myself an art therapist up until I get the full art therapy license. That doesn't apply yet in Pennsylvania because we're still under the LPC. For Tina. Do you see the chat?
Answer Cynthia's question. How do your degrees licenses translate when you move to another state or country? So as far as the ATR, that's nationwide. That won't change if you change states, but the LPC has very specific requirements state by state. And I know for me, that was a challenge when I moved. I was looking at different states and my education from Oregon wasn't necessarily going to meet the requirements for an LPC in all states that I moved to. So that's something to consider ahead of time if you're going to be moving. You can look at the education requirements for each state under their LPC application if you're going to be pursuing that. I don't know for another country though.
Yeah, I don't know about internationally. That's one other thing that, so all the licenses, the art therapy licenses that are being developed around the country, that's another function of ADA. ADA is kind of being a center, like a spoke for all that legislative work. And they're trying to have it be that all the art therapy licenses are going to be interactive and have reciprocity, so that if we can get art therapy licenses around the country, then art therapy, our profession will be more portable. But right now, every state has different requirements, and so that creates hurdles for people, and it makes it harder to be mobile, to relocate. So
this question about nursing homes, about utilizing art therapy in nursing homes. I worked for, it was Presbyterian Hospital at the time, and they had sort of residential partial programs in various nursing homes. So I didn't set that up myself. I worked for an agency. I know that funding can be tricky in nursing homes because Medicare and Medicaid only pay for certain things. I'm not exactly sure how you'd go about doing it independently. Sorry, I don't have that information.
Yeah. And I personally don't know about Canada, how that dovetails with our licensure. But one thing you can do is, for any of these governmental organizations, a license is a law. And every state has a website of its code. So if you do a Google search for, like, you can ask the Canadian Art Therapy Association, that's an idea. Or you can also go to the state's website and do a search for, art therapy licensure or, requirements. So just doing some Google search, get in there, and then they have their whole code, and you can read what the law is about who can do it, who's grandfathered in, can you relocate, and will they accept? So that information is all accessible online as well. the Canada Art Therapy Association is helpful. ADA also has a bigger picture view of the whole country in terms of reciprocity and portability. So that's it. Let's see, I see that it's noon, and so we're exactly at our stated end time, and want to really be just respectful of everyone's time. I'm so glad we had 44 people, more than 44 people at the height of today, which is wonderful. And we really just want to let students know that we are here for you. We want to invest in you. You are the future of the profession. At times in the past, I think PATA and DVATA maybe didn't engage you enough. And so we really want to be consistently there for you in terms of answering questions, helping you to navigate your world. We would love for you to consider joining PATA again and ADA as members once you get a salary. And so there's that. And we also want to just give a big thanks to our panel. Thank you all for taking the time out of your weekend and also some of our prep time. Thank you for all that you've brought to our program today. So thanks. I can stay on a little longer. If anyone just wants to hang and ask a couple more questions, I can probably stay till 12:15 unofficially, but I want to let anyone go who needs to go back to family, or this is the commitment that we all agreed to. So, all right.
I'm gonna hop off, but thank you. Thanks, everybody. Take care.
Yes, it was
Thanks,
a pleasure.
Tina, Megan.
Thank you.
Megan. Thanks,
Mike.
Meredith.
Thank you.
Thanks, Mindy.
Mike, I'll put our PATA email address in the chat box too. I can help direct questions if people have them afterwards.
Oh, awesome. Yeah, so anyone who's still here, they'll get that when we send out the minutes of it. Hey, Stephanie.
But I gotta go. Thank you, Mike. Thank you, everyone.
Thanks. Yep, everyone who's still on, there's pata.org@gmail.com if you want to email us. Okay, I'm going to take off the share. Question, can someone just have a practice with just teletherapy? Absolutely. Now, that absolutely, comma, that depends. Telehealth was not universally paid for by insurances, so you certainly can do it private pay. That's one option. Insurances didn't always pay for it. Certain organizations, I think, got paneled, meaning if you want to be eligible to receive third-party payment from an insurance company, you would have to go become paneled. So you would have to apply to different insurance companies. They get you on the list. So that being said, there are some telehealth companies and organizations. But during coronavirus, the government relaxed that and made a temporary, what's the word? Not ruling. Forget the word for it. Temporary rules relaxing that. So that way, ever since like March, all insurance companies have been paying for telehealth as if on the same rates and everything that they were paying for in-person visits. Just because of the suddenness of the change, they didn't want people to lose their therapy. So I believe that was extended through either until the beginning of September or the end of September. Who knows if there's a relaxation, if the world has opened up and they expect people to go back to live therapy. It's unclear right now if they're going to continue to pay for telehealth for mental health. Not sure. I haven't heard any guidance in quite some time on that, but they've extended it far enough out that, we have some time. Let's see, question, can someone just how does that work if you're treating people via teletherapy from another state or country, if you're only licensed, et cetera, in Pennsylvania? Same thing. Certain states, not all states, you have to check. Up until now, telehealth had to be within the same state, wherever you're licensed. You had to be licensed in the state. So if I wanted to work with someone in Kansas City, Missouri, I would have had, in the past, I would have had to have a license in Missouri as well as Pennsylvania. Now, I have one associate in my practice had the same thing come up. She was working with a family from New Jersey who came into Center City, Philadelphia to work with her. And the first 2 weeks of telehealth coronavirus, she wasn't allowed to work with them. They weren't going to get insurance coverage. All of a sudden, that was changed. New Jersey issued an edict or a change in policy saying temporarily you can cross state lines. We're going to accept other people's other states' licenses if that clinician applies or registers. Just fills out basically it's a one-page form. That's temporary. So who knows how long that's going to last as well. If you're really interested in telehealth on an ongoing basis, I think then you'd have to really dig in and do a lot of research more than what I'm aware of. But those are the basics. That's the depth of my knowledge right there. Interesting questions. Anyone else curious about anything that we didn't have time for?
Mike.
Yes.
Can you hear me?
Yeah, 1 second. As someone who has a job offer pending to be a therapist, running both arts-based and core therapy groups, I want to ensure that I'm getting enough art therapy hours weekly. What range of art hours a week should I be aiming for as a registration license or licensure? We have to separate that into two answers: registration and licensure. All of your therapy experience can be counted towards licensure because that's total client contact, client hours, treatment hours. And so that does not have to be art therapy specific. And so any of your hours will be accrued. Specific to art therapy, the word enough is really, it depends, is the true answer, because what is enough? It's whatever amount of hours that you get, that's what it is. Those are the hours that you're accruing. And so if you want to accrue hours more quickly, then you'll either need to do more art therapy groups, get permission to do more art therapy, or change jobs, or get another part-time job that gives you more art therapy hours if you want to accelerate the accrual of those hours. So getting enough really has to do with your expectations and your timetable. It'll just determine whether it takes you a little longer to get your ATR or if you get it in a little bit less time. Yes. Oh, and then Cynthia, were you about to ask me a question?
Can you hear me?
I can hear you, yes.
I saw something online. I didn't know if it was legit or not, so I wanted to ask you guys something about art therapy without borders. Is that a real thing?
I've never heard of it. Who's I don't know if anyone else who's still on the call knows about that, or I've never heard of that myself.
I'll have to find it. I can email you the information.
I have a couple information. Back to Courtney's question, actually there are hours, and you can look at the application for the ATCB. So your question about the hours for the license, you can accrue all of the hours, whether they're clinical or otherwise, for your license. But for your ATR, they do look at your clinical only hours. So the work that you're doing in art therapy, but they also will count hours related to you know, family meetings, things of that sort. So pull your application off the website, you know, see what you have to fill out towards the very end. Art Therapy Without Borders is an organization that I believe Kathy Macchiotti oversees with several other art therapists, and they have several other initiatives. So you could reach out to them for more information.
So that is a real thing then.
Yeah, I mean, I'm not involved with that organization, but you could reach out to them to find out more.
Do I just look up, so that was okay then? Like, so I just look up Art Therapy Without Borders?
Yeah, they have Facebook pages, or you can go to Kathy Macchiotti's website, or
Yeah.
whatever.
Louisa Lightfoot sent us in the chat a website, a link to it, atwb.org. If you check in the chat. Thanks, Louisa.
Thank you.
Oh, there's another question. I heard there's a 5-year cap from graduation on getting the ATR. Is this true, or can I take my time?
You want to answer that, Mike?
I can answer. You can elaborate.
Okay.
Basically, you can get it any time in your career, but they do have it. Is it 5 or 6 years, Michelle? That it has to be within a span.
I think it's 5 years for the ATR. It's 7 years you have to get your LPC. So this is where some women in particular have difficulties, because if you start your career and you're accruing hours and then you take a hiatus, let's say to have children or raise a family or take care of a sick loved one or something like that, and it extends beyond that time, you lose all those hours that you've accrued originally. So you definitely want to make sure that you are working towards that right after graduation, so that your educational hours are as close to your supervisory hours. You don't want to necessarily delay. So I would not, I mean, you can take your time within that 5-year period. I mean, you can also look at the application. I was going to pull that up to take a look at it to see if there was any changes recently. But if you go to the ATCB website, you can go to their application handbook and pull that out. And then there's the application within there, and all that information should be within that. So
Right.
I'll look at that real quick and you can elaborate.
Yep. Yeah. And so that's open to you. Absolutely, you should go and just check that out. You can print it out. You can have it on paper. You can mark it up, to give yourself things, just your own guidelines, that you can adhere to. Everyone, just so you know, this is Michelle Dean. She's the president-elect of PATA, in case you don't know her. And so she was not on the panel, but she was with us during the presentation. All right, I'm going to need to hop off in about 3 minutes, everyone.
Just one more thing. Do you ever do like collaborations with other types of therapists, like music therapists or anything like that?
You mean privately, personally, or as PATA?
Like in general, like for the profession, like in general, like did you ever do that? Is that come in handy, or?
Yes, well, I mean, in private practice, I collaborate with all different modalities in the community. We often have treatment teams. So unlike, a hospital where the treatment team is all under one roof, you might have all these different outpatient practitioners who are working together. You call and interact. Also in my therapeutic special needs camp in the summer, music therapy and art therapy have been the backbone of the program and actually guide all other counselors and activities. And this year we're also adding dance movement therapy because we're transitioning to an online 2.5-hour program instead of a full day program. And we just needed more movement-based activities because kids are just going to be sitting in front of screens. So we need people to have more movement. In the past we had sports and archery and gaga and some other physical things. So we didn't have DMTs, but yeah, so in my practice, I value the other creative arts modalities so much. And and camp is the place where I can really have them in-house.
Thank you.
Yeah, you're welcome.
I have more information about the ATR application.
Okay, you want to do that, and then maybe that'll be our last thing we talk about
So
today.
the application, it doesn't specify the length of time for the ATR. It looks like you can get that, but I know the LPC definitely has time.
LPC, yeah.
So it would make sense that you get your ATR, so you sit for that board certification exam, which would then apply to your license. So in which case that would be sort of an incentive to get that within the same period. Otherwise, you'll have to sit for the NCC exam.
Yeah. One other sort of soft suggestion, just based on my own experience and wisdom, of the closer you sit for the ATR, the BC exam, the closer the sooner it happens after your graduation, the better, because you'll still remember a lot of your art therapy content, art therapy history and theory and assessment, and that's all in the BC exam. If you wait years and years and years, you're going to probably lose a lot of that knowledge. There's also going to be a lot of new things that come along, and you're going to have a lot to learn, a lot more for the BC exam, and there's going to be a lot more hard studying. So just sort of just the wisdom of life thing, and having also supervised a lot of people that have gone through that. If possible, if you can manage this in your life, I suggest to do it sooner upon graduation rather than much later, just for ease. Not that it's easy. Alrighty. All right, friends, it was so great to have you, and we will send out sort of the summary of a lot of the chat that happened. We're going to send out the PowerPoint, and we're here for you, and we're really happy to be with you today. So have a great rest of the weekend, and take care. We'll be in touch.
Thanks, Mike. See you later.
Thanks, Michelle. Bye.
Bye.
Hope you're well.